Today I'm going to talk to you about congenital anomalies in children. These are problems that children have by birth which may require surgical treatment. It is estimated that about 2% of all children will have some kind of congenital anomaly, and about 1% of these are serious and life-threatening, which will require some form of intervention. We are all familiar with children with heart disease, but it is also important for us to know that newborns can also have other problems such as those involving the lungs or the intestines, which can also be life-threatening. Luckily for us, nowadays, a lot of these anomalies can be detected by antenatal ultrasound. That is, the ultrasound of the child is done when the mother is pregnant. If an anomaly is detected at that stage, the mother has the option of getting admission into a hospital which has a tertiary care level center for the management of the abnormality. This is easier to do rather than transport the child after birth. Once the baby is delivered, the baby is usually taken to a neonatal intensive care unit where the baby is kept and investigations are done to find what the problem is. Once we have detected what the problem is, then an appropriate decision is taken to figure out what best to do. A lot of these abnormalities may not require any surgical intervention. However, there are certain abnormalities where surgery is necessary. For example, there is an abnormality where there is a problem with the food pipe. This requires a major surgery to be done. In addition, there are certain abnormalities with the intestine where the intestinal continuity is not proper. Therefore, again, surgery needs to be done. It is important to remember that all these surgeries that are done on these small children have to be done under the guidance of a good pediatric anesthetist and at a setup where there is a good neonatal intensive care unit. With time, the results of our treatment of such children have improved, and almost 95% of these children do very well. And therefore, one should not be unduly distraught at the thought of having a baby who has one of these congenital anomalies.